Hello, good evening. Tonight I am being joined by two very experienced therapists from New England Fertility Institute. We have Samantha Levy and also Jennifer Strom joining us to talk about emotional support for egg donation and surrogacy, which is a huge topic to cover. And so we'll do our best to cover as much as we can. I have donor-conceived children, so it resonates a lot with me, and I'm very excited to hear their thoughts. So let's invite them in now, and we can start. Welcome to everyone who's joining. I'm just inviting them in. Hello.
Hi.
Hi, how are you doing?
Good. How are you?
It's lovely to finally meet you.
You too. Jennifer is on a different Instagram, so I just want to make.
Yes.
Okay.
Yes, I'm just, excuse me whilst I just try and find her on here. I'm just looking for the handle now. Let's see where she is. JS. She may be here in a second. There we go. Okay, I've invited her in, so hopefully that will work in a second. I've just introduced you briefly and our topic for tonight, but if you could just tell everyone joining a little bit about you and your vast experience, and then we can begin.
Sure. Absolutely. So my name is Samantha Levy. I'm a marriage and family therapist here in Connecticut, in the United States, and I work very closely with New England Fertility. I also work with other agencies and other clinics as well in the U.S., seeing clients who are going through infertility treatment, surrogates, egg donors. We do psychological screenings, and we also provide support during surrogacy journeys as well.
Amazing. So we'll come on to talk a lot about that. We've had some great questions which have come in as well. Let me just see if Jennifer is here.
Yeah.
And then we can start. And if anyone has any questions as we're talking, it says that she's unable to join. So let me try again. Yeah, if anyone has any questions as we speak, please do feel free to ask. That's what it's here for. Okay. Let me try again. Perhaps if we make a start and then maybe Jennifer can request to join. I've just tried to invite her in.
Sure.
So thinking about emotional support, and I was just saying before we started that I have donor-conceived children myself. So I know firsthand some of the feelings and the thoughts that come with that. Obviously, every situation is unique, and I know that you work with same-sex couples. You also work with heterosexual couples and solo parents by choice. So please could you start by talking a little bit about what people should consider when they're starting to think about egg donation or indeed surrogacy?
Sure. So I think for heterosexual couples, it's probably the most important thing for them to do is to talk to each other as a couple and make sure that they're both on the same page, that they both want to pursue egg donation or sperm donation.
Mm-hmm.
And we see in our practice that the couple needs a few sessions, a few therapy sessions, just to make sure that both partners are on the same page, because sometimes they aren't. And we really feel like protecting the relationship and protecting the marriage is most important. For same-sex couples, it's the same thing. They're not grieving the loss of fertility because Oh, there's Jennifer.
Hello.
Hi, Jen.
Hi. How are you?
Lovely to meet you.
Lovely to meet you too.
I'm sorry for the difficulties getting you in on here, but it's
Oh, it's
lovely to have you
okay.
join.
We're on it, so it's all good.
Yeah.
We've just started to talk a little bit about different scenarios and considerations when people might be looking for a surrogate or deciding that they might be looking for an egg donor. Before we go back into that, please could you just introduce yourself to those who are joining, and then we can take it back to where we were.
Yeah, absolutely. My name is Jennifer Strom, and I'm partners with Samantha Levy, and we work as therapists. We work with families and couples, and we focus a lot on fertility struggles, working with both donors, carriers, and on the intended parent side on all the emotional aspects related to going through this process and just fertility and fertility struggles in general.
Hmm. Amazing.
So nice to meet you.
You too. And Samantha, just to pick up back to what you were saying before, please carry on.
Yes. So just to review, Jen, what I was saying was to first consider if you are a heterosexual couple that you're both, or a same-sex couple, that you're both on the same page about using a donor, whether that's an egg donor or a sperm donor or both. Because we as relationship therapists really want to preserve the relationship and make sure that both partners are starting on this journey together in the same place. And sometimes that takes a little while. Sometimes it takes one of the partners a little longer than the other to get on that page.
Would you say that because situations are different, so for example, with myself and my husband, there was very much a grieving process with lack of genetics. Would you say that that's different for solo parents potentially, or same-sex couples who might be slightly more excited about choosing a donor or a surrogate than people who are sort of more forced, well, not forced into that route, but they've suddenly had this, you know, reveal perhaps of infertility, trying to get to grips with it, and then realizing that that may be their path to parenthood?
Yeah, I mean, I think one of the things that we always consider when we start talking to anyone is what their particular journey has been and how they got to that point. So you're right, when we're talking to a same-sex couple, the expectation is that if they want to create their own family, that it's not going to be like they would need an egg donor if they were going to do it in this way. When we're talking to somebody who's going through this on their own, or if we're talking to a heterosexual couple, this may not be the way that they intended to have to start their family or to grow their family. In addition, people have all different things that they're considering. So they may have thought that they would adopt. They may have thought that this isn't, they would never be managing fertility struggles in the first place. So the first thing that we're always looking at is less overall the type of group that we're talking to, but more what their particular journey has been and how they've gotten there. And that really helps us understand the context of the types of discussions that they may be stuck on, or the kind of conversations that they may have had or that we think would be helpful to have together.
Would you say that for someone who might be considering egg donation, let's say for a couple or someone who has experienced infertility, that they may have pursued multiple rounds of IVF trying with their own eggs before they get to that decision, and it takes a while to perhaps reach that decision, whereas a same-sex male couple would know that they need egg donation from the beginning?
Yes, often. I'm sorry, go ahead, Samantha.
No, no, go ahead, Jen. It's okay.
Yeah, often in that case, by the time they've gotten to us, or there's been a point at which it makes sense to talk to somebody like us, there have been other steps involved. So we find that that exact conversation can be one that's the hardest to have. So when people have tried using their own eggs and there have been multiple cycles or multiple failed cycles, and they have a conversation with the doctor that this might be the way that makes the most sense to start or to grow their family, that often is a time where we're brought in to have a discussion, like Samantha said, also to make sure that everybody's on the same page. There are other couples, though, that either it's a first time starting their families and they're older and they've waited and they haven't frozen eggs, or it's a second marriage perhaps, and their eggs aren't the same place that they were 15 years ago. So there are people who do go into this already knowing or expecting, or because of something related to them medically prior in their lives that they knew they would never be able to carry. So there are couples that know this is the way that they're going to create their family, but you're right that oftentimes it may be more of a surprise, and there may have been more disappointments on the way, and that is something that we obviously want to make sure that we talk through, because we want to understand that everybody's on the same page and everybody's feeling good and at least hopeful about the journey that's to come, rather than only focusing on the disappointment.
Mm-hmm. Yeah.
Right. We encourage patients who are going through the process to reframe it that it's not a last resort, but it's a path
Mm-hmm.
to. So we really want, especially for women who are grieving the loss of their genetics by using an egg donor, we really want them to understand that it's normal to feel grief,
Mm-hmm.
and that it's a really long time, and you're never really fully accepting of losing your genetics. Although once the process is over and you have your child, you are overjoyed. And a lot of times patients will even say that they don't even really remember how they got to that point because it's a little bit of a blur. But at the time, it's very, very difficult. And we do work with patients a lot that are in that space.
Mm-hmm. I can resonate with that completely. I think also when we were going through it and looking at sperm donor conception, it was very much talked about as the backup sperm.
Mm-hmm.
And I hate that word. Now we have our children, backup is just a horrible
Mm-hmm.
word because it doesn't feel like an inferior choice, and we wouldn't have them without that help.
Mm-hmm.
So even language used sometimes can make a difference, can't it, in terms of how people feel with the experience of going through it?
Yes, you're right.
Yeah, and that's a really good point. I think that as people embrace the idea of how they're going to create their families, what Samantha and I really like to do is really normalize this. So, the idea, like you said, of saying backup suggests that it's not normal or that it's a second choice. But
Mm.
this is a way in which many people choose to create their families because it's the best way to create their families. So we try to be very open and create an opportunity to have discussions about how, to most people, like Samantha said, when they look back, they won't even remember this part. I know that's always hard for everybody, and I'm sure you can relate to that. We're worried about all of the things that we've struggled with and all of the logistics, and there's expense and there are relationships and there's stress. But once you are holding your baby, once you've grown your family, those aren't the things that you even turn back and remember. So it's definitely not backup. We really like to normalize, one, the hurt that comes with struggling with anything, in this case with fertility, and two, that this really is a very normal way to create a family. It's just different sometimes than how you anticipated creating a family.
And what about for surrogacy?
It's the same for surrogacy. I think the loss for a female at least who's never carried a baby and turns to a gestational to carry their baby for them, I think the loss is maybe sometimes harder because they're not able to experience pregnancy and they're not able to give birth to their child. So it takes time, and sometimes it does take the whole 9 months to be able to come to terms with the fact that yes, you'll be a parent. It's not necessarily the way you thought you would. But again, we like to reframe it. Instead of saying it's a last resort or it's a backup option, it's sometimes the only option. And
Mm-hmm.
we always tell patients, and I know that Dr. Levy always tells patients, that if you're willing to try anything, you will be a parent.
And at New England Fertility Institute, do you offer this emotional support with anyone who is going through third-party reproduction?
Yes, we
Yes,
do. Yeah,
go ahead. Sorry, Sam.
we're not together. I'm sorry. But yes, we do. So we offer emotional support to all the patients. We also offer support during the journey. So after they've become pregnant and they're off, they've been discharged from New England Fertility. We also like to stay within the journey with them and kind of guide them through to the end.
Amazing, amazing. Because there are a lot of people out there, with my husband included, who may think or say, I don't need counselling, I don't need support, I don't need help. And actually they might be silently struggling or not knowing, not realising that support would actually be very, very beneficial. So what would your advice be to people who are slightly apprehensive or sceptical about having therapy to coincide with third-party reproduction?
I think therapy is helpful always if somebody feels stuck. So it really comes down to, in your case, you or your husband or whoever is involved, to understand that there are times when having somebody else who's spoken to other people who are in their shoes or who are specifically trained to hear what you're saying and help figure out exactly why you may not be feeling good. Um, so the benefit to talking to somebody like us is that we can sort of hear through the content. So we're able to listen and really help figure out what pieces of this are the ones that may be making you feel better or worse, and play on your strengths as a couple or your strengths as an individual to help get through this process more easily. You know, one of the nice things about New England Fertility and Dr. Levy is, with working with so many people who have gone through this process, they really believe in emotional support throughout the process, because it's much more than just the medical choices and the logistics. It's all about people. You asked about, you know, what about when you decide to use a gestational carrier? And the reality is that introduces a whole nother relationship into this process. So that's another good reason when you're going through it in that way, is we make sure that everybody's comfortable communicating with each other. And any relationship is about communication. And that could be with your doctor, that could be with your coordinator, that could be with your donor if it's an open donation, that could be with your carrier, that could be with your partner, that could be with your parents. So what therapists really can help do is figure out how to have those conversations most constructively. And so it's not that you need therapy because something's wrong. It's just that we can help figure out what strengths you have, and work through conversations to make things more easy, like flow more easily through the process.
Mm-hmm. Yeah, that's great advice. And for people who are obviously concerned or devastated about loss of genetics, what would be your advice for kind of getting excited about the process and looking at this through a fresh lens?
I think, you know, like I said, I think reframing it into, it's not really a loss, it's a gain, because you can still have the experience of pregnancy. If you're not using a surrogate and you are using an egg donor, you can still have the experience of having a baby and growing the baby, feeling the baby inside of your womb will help you to connect with the baby. And although there really is no good advice for someone who isn't using their genetics, I think it's something that you have to help the patient to come to terms with. And however they get there, everyone gets there in a different way.
Mm-hmm. Because I get a lot of people saying to me things like, will I love the baby? How will I feel about the baby? You must see that a lot, or must hear that a lot.
Yeah, and I think that's a very natural, you know, we encourage people to really explore everything that they're feeling, because it's important to be able to live in those emotions in order to get through those emotions. Once you can get through those emotions and really verbalize them, then it really becomes an opportunity. So it's the end of the expectation of how it would happen for some people, but it's also the beginning of the opportunity of being able to work in this way to create a family. And, you know, things are so much different than they used to be. People create families in all different ways, and that's the really wonderful part. So I think getting through those emotions and those feelings and not ignoring them is a big part of how to start a journey in a good way.
Mm-hmm. And for people who are looking for an egg donor, let's say, what should be a consideration in terms of anonymous versus open these days?
So I think that the main issue is really there is no anonymity anymore. There are many programs like ours that we do provide anonymous egg donation, provide anonymous egg donors, although we do counsel the intended parents and the donors that there really is no such thing as anonymity anymore. And so there will be very limited information that is given to the intended parents on the donor, and there's no information that's given to the donor about the intended parents, the recipients. But like I said, you really can't guarantee.
Mm-hmm.
Yeah, and we want to make sure, and that's one of the things that we do talk to donors about is, you know, with things like 23andMe and just with information being shared so readily, even if a future child from donation is not going to reach out, we want to be sure to have the conversation, the what ifs. So so when we're speaking to a donor, we want to always have a conversation about, have you considered the possibility of, because it's important as people are making decisions for us to feel comfortable and for the clinic to feel comfortable that everybody's thought through these things. Or if somebody's not in a relationship and they're a donor, what are their thoughts about sharing this with someone in the future? Just to make sure that they're going into the process having asked the right questions.
Yeah, exactly. And I think back to your point about there is no anonymous, anonymity has, has changed these days. So we got contacted just last week by parents of children who have shared the same sperm donor as us. We signed the children up to the donor registry 5 years ago. And so we wanted this to happen, but it was just an email out the blue. And so it's those kinds of things which I know people are asking questions about and we'll come on to, but getting past the fertility treatment part, it's how do you sort of manage the relationships longer term? So whether that be with third party reproduction, whether that be with a surrogate, whether that be with an egg donor or a sperm donor, what are your thoughts on that?
So go ahead, Samantha.
No, go ahead. You were going to say
So
something.
I was going to address it more from the gestational carrier position, and that's something that we always do discuss, because in that case, that there either is or is not going to be some sort of relationship. And when they're entering into a journey, some people have very clear expectations of what they want that relationship to look like after delivery, and others aren't sure. So the way we look at that in the case of a carrier is that relationships develop organically over time, but we do like to set expectations from the beginning. And similar to donation, if it's an anonymous donation versus an open donation, there's going to be much different expectations about the kind of relationship that could and would exist. So it's not so much that there is a right and there is a wrong, and that's what we always tell people when we're in the room with them. It's that we want to ask the right questions and open up the conversations to think about what you might want the relationship to look like moving forward, whether that be with a donor or whether that be with a carrier. And it may turn out differently because relationships are organic and flow over time, but we do want to be sure that people have thought through it. And if that you're matching two people, that's been thought through as far as, are the perspectives the same? And if they're not, let's talk about it now so that there are no surprises down the road.
But when donor conceived children reach 18 and they are able to trace the donor if they so wish, and that's been the agreement, I guess there's been sort of a whole childhood and growing up of 18 years of uncertainty about what that person's going to be like, almost putting them up on a pedestal because they don't know who they are necessarily. And I mean, I have this anxiety as a parent of donor conceived children. Even though this person has said they're open to contact, what happens if the children want that contact and they're not? There's not really anything we can do to change that, is there? So how do you parent donor conceived children, let's say, to be prepared for what may or may not happen?
I think it's really important to start when they're very, very young. And instead of talking about it as if something went wrong, it's their story. And their story is their story. And we have to protect them, of course, in the case where, as you mentioned, if they become 18 years old and they seek out the donor and the donor is perhaps not able to be found or not interested. But I think most of the time, from what I understand from patients that we've worked with, it's a pretty easy thing to do if you start early enough. And instead of waiting and holding on to this information and then kind of waiting for the right time to tell them, we feel like it's really much easier to tell them when they're very, very little. And then as they grow older, you give them more information that they can understand.
Mm-hmm. My daughter said, our eldest daughter, who's 4, she said this morning, "Mummy, can we go and meet the donor in America?" So, even these small bits of conversation have started to unravel some questions and some, I guess, she wants to know more about it. And we're okay with that because, as you said, it's their story and we want them to feel comfortable talking about it so that it's not something that they're ashamed of or that's something different. And I feel like the way the world is moving and with modern family building and third-party reproduction, it's becoming more accepted. And a class full of children, there's probably quite a few children who have come through fertility treatment, through donor conception, who may have 2 moms, 2 dads, 1 parent, And so I'm hoping that the way that the world is, sees family building is starting to change. Are you finding that?
It's a good point. So one of the things that we often talk about is that our anxieties are our anxieties, and as parents, our anxieties are always going to be for how um, things affect our children. However, like you're saying, for our children and even children who are older, this is what they know. So, as children learn their story or learn stories about others around them, they don't have a notion of what's normal. So, we as adults carry anxiety about the things that we've been taught and that we know, but children don't know any differently. So, they know, as you said, people who grow up with one parent, with two parents, who have been adopted, who have been conceived in different ways. And to them, that's just the world they live in. So we always counsel parents to be careful that we talk through our own anxieties so we don't project them onto our kids, because our kids very often don't know any differently. So what we think may be different is not what they see as different. It's just their story or the stories of those around them. In the same way as they learn where people grow up and who lives in their house. So we have our own notions in the generations that we grow up in, and that's not the same notions that our children have.
Do you think that changes with the age of the child? As in, obviously, they're very innocent and sweet at this age, and then perhaps going through, into teenage years. That does the kind of does it change in terms of how they perceive how they were created and their upbringing?
Well, to what Samantha said, the earlier you start talking to any child about this, that's just their norm. So as they get older, it usually would suggest that they stay as open-minded, if not more, as they understand more. So the more natural this conversation is, um, the less defensive they become about that conversation as they get older. So that's a good reason to expose them to those conversations when they're young.
I think it's also just through my experience, and please tell me what you see as therapists as well, but um, perhaps educating your wider family on the setup as well, because my husband and I are freely talking about it, and as I mentioned, half siblings have now come into the mix. We went on holiday last week, and our eldest daughter grabbed my phone and showed our family pictures of her half siblings without any context. So that was like, whoa, a real shock for them. And they were trying to, be very sweet and supportive and interested, but you could see them almost reacting to it. So I'm wondering, how should family members support third party reproduction to help those they love with it as well?
So I believe that family members, should be told at an appropriate time that feels right for you. So for every family, this is different. And we do recommend that the child, if you're going to tell the child, that you are the one to tell the child. Because once you start to tell your family members, sisters, brothers, cousins, etc., and you have not yet told your child, it may come out Thanksgiving dinner or Christmas dinner. And so you have to be really careful. And again, we always put the child first from the very beginning and protect the child. So having family members support you can be a wonderful thing in most situations. And, like I said, it's really up to the family, the individual family themselves and the parents of the child or the parent to decide what to tell, who to tell, and to decide how those family members will support you.
Yeah, I think that's great advice. And someone sent a question in earlier asking, slightly to the point of family, but more family friends, if you're concerned about grieving loss of genetics, let's say, and someone says, "Oh, your child looks like you, and you're not genetically related." How should people respond to that? Because it may drag up feelings of despair again and take you back to that point of the struggle that you had to get to your family.
We tell people often, whether that situation or any other situation, like people get asked all sorts of questions. For example, when working with same-sex couples, they often get asked whose genetics it is. Um,
Mm-hmm.
so we always, the best way to manage that is really to prepare for it. So talk to other people who have been in a similar situation. to think through all the questions that could be asked and prepare for what you think your answer should be. As Samantha alluded to, just like with your family, you choose how you respond. There are different ways to respond. Some people, you can simply say, that's none of your business. You can simply say, thank you. You can joke, cry. There are different ways that people manage it, but we find the best way to manage your emotions around that is to think about all the awful or all the just ignorant or all the harmless things that people may ask. But really thinking through that before you get into that position is helpful. So when you do get there, you don't find yourself in a position to not feel happy about the way you're responding. If you're prepared when that question comes, you usually will feel much better.
And do you find that same-sex couples versus solo parents versus heterosexual couples who need third-party reproduction, do you find that the ways that people respond to that are different based on the scenario, or do all of those people, or does everyone have some sort of apprehension going into third-party reproduction?
I think everybody has apprehension as far as this topic that we're discussing, apprehension about how others react, whether that's your family, whether that's friends, or whether that's strangers that see something on social media or a stranger walking by you on the street. I think it's natural to have that kind of apprehension, so normalizing it. We all have apprehensions about the questions that we can't control that people are coming at us about, and introducing a child into the world in a different way, or someone asking a question that should be harmless that doesn't feel harmless to you, having apprehensions about that is completely normal.
Mm-hmm. And I think we may have answered this before, but someone was asking, you've mentioned timing, talking to children from an early age, the strategy and methods. Yeah, in terms of methods, and just a question about that too, what resources and books would you recommend to help guide the parents through that, so that you've almost got a support around you to start these conversations?
We do have a list of books that we'd be happy to provide to you. Eloise will send it to you, that we recommend that patients use who are either using a surrogate or an egg donor, or both.
Okay, great. And I'll share those with everyone afterwards, because that is a question that comes through a lot, where to go and what, the support that's needed. We have some books that we use which are kind of instrumental in how we piece it together, because sometimes we're nervous about saying the wrong thing, which is ridiculous when it's your own children and they're so young. But I feel like, to your point of starting that narrative early, you're almost also doing it for yourself, so that you're rehearsing saying these things so that it becomes more of a normal conversation, rather than suddenly sitting down and bringing something up for the first time. So it's part of your everyday, even if it's just an odd sentence here or there, and then the child says, can we go and get lunch now? Just to bring it into the room.
Absolutely.
Yeah, you're right. You're absolutely right.
Is there anything else that you would, because I know that you run online peer groups, what else would you suggest for people who might be same-sex or solo parents to be, or needing, heterosexual couples needing egg donation or surrogacy? Tell us a bit more about the peer group support that you offer.
Peer group support in general, and the peer group support that we offer, the intention is to allow people to feel and hear that there are others who have gone through similar experiences, even if it's not exactly the same. And we find that in this situation, it is so nice to be able to connect to others or ask questions of others who are either going through similar or who have been through similar situations. When people are unable to attend peer groups, we think things like what you're doing, opening up conversation or finding someone else through someone like us, or through other resources that they can connect with if they don't feel comfortable in a group setting. Just any way to understand that what you're going through is very normal, and connecting with others who have been through similar will give you additional perspective, so you won't feel so alone.
Definitely. And if people want to speak to you for personal support, what's the best way that they can do that?
They can either reach out to us through New England Fertility or directly through our website, which is JSRC Group. Either way, They can that way.
Fantastic. Well, thank you both so much for your time today. If anyone else has any more questions, please feel free to DM us or DM New England Fertility Institute, and we'd be happy to take some questions or arrange putting you in touch. So thank you both. Is there anything else that you want to end on, or any thoughts to finish with?
No, I think overall, always your questions are all spot on. And just this is really about everybody's individual journey being theirs, their story about how they create, build, grow their family. And no journey is exactly the same as the last. So it's important to reach out for support, whether through peers or through a therapist or just through family members, through your partner, just because there are challenges and there are struggles and there are different points of time where you've made decisions. So we never like to ignore the emotional components of any journey because it's a journey. And like any journey and any other struggle, there are points at which you may need extra support. So we take that seriously, and we truly believe that whether through peers or doctors or family or people like us, it's important to get that support because these are big decisions and they're about more than logistics and medical decisions. They're about people and about the ways that you've made decisions and create your family. So we very much understand that and like to be supportive of everybody who's going through it.
And that's a really good point, because for standard IVF, it's obviously very, very difficult. When if you have a child through IVF, you don't forget infertility ever, and you won't forget your fertility treatment, but you can move into a sort of you know typical family building scenario of raising your children with both genetics, etc. However, when you're using third party reproduction, whatever scenario that may be, you have got that not complication, that's the wrong word, but you've got that extra part to it that's going to be with you throughout life. So you're right, it is a very big decision, and it's something that will stay with you. So having guidance from therapists such as yourself, I believe, is invaluable, because it can feel overwhelming at times, especially before the children have come into the world.
Well, and like you mentioned even with your husband, and any hesitancy is it doesn't mean something is wrong that you may need support. It just means that it's a complicated decision, and it's one that we often like to make sure that you're asking yourselves all the right questions, and like we said, looking for your strengths, because whether you're going through this on your own or with somebody else, you have strengths and we know tools. So we can help with the conversations that it takes to get you to feel better about where you're going.
Mm-hmm. And for people who may have more than one child, may it be common that children kind of have different feelings about it as they grow up, depending on their different personalities?
Sure, absolutely. I mean, I think every child, I'm sorry, I think what you're asking is if there are siblings and they are all conceived and how each, yeah, sure.
I mean, I'm starting to see that slightly with our children. We have three very close together, and we've started to think one of them may want to contact the donor, one of them may not, and it will just depend on their personalities, because they will have had the same conversations with us. So just wondering whether you've seen that play out sort of further down the line, and what parents using a surrogate or an egg donor may sort of want to consider or be prepared for when it comes to that scenario too.
Well, I think it's like siblings in general, or even when you're managing and you have twins, all siblings are different. They're just little people. So the way one may react to any situation is very different than the other. So yes, there's definitely the potential that one may have more questions or manage those questions differently. And it's like that as you move through life, as you know, with your kids in every situation. So I think understanding your child's personality and the things that they may ask and the way that they may react and how to respond to them based on who they are is important in this situation.
Mm-hmm. Wonderful advice, thank you. As I'm sure anyone listening will have gathered, Samantha and Jennifer are absolute experts with over 20 years experience in therapy around third-party reproduction, egg donation, surrogacy, as are New England Fertility Institute. So if you're contemplating, wherever you are in the world, if you're contemplating looking into that, then please don't hesitate to contact them directly, or you're welcome to come through Fertility Help Hub. But thank you everyone for joining, and it was lovely to speak to you both.
Thank you. Have a good
Have a good
evening.
day. Bye.
Bye
Bye.
bye.